from the Taiwan MPS Society. MPS is a rare genetic disorder, also known as mucopolysaccharidosis. MPS can be split into 6 types. Now, let's welcome Dr. Chiao-Pao Chin, the director of the Genetic Counseling Center at the Kaohsiung Veterans General Hospital, to talk about MPS Type II.
MPS Type II is also known as Hunter syndrome. It is the most common MPS type in Asia, accounting for 40 to 50% of all MPS types. Based on degree of mental impairment, symptoms range from mild to severe. Children of MPS lack the enzymes needed to break down mucopolysaccharides. The abnormal buildup will lead to progressive damage to the organ systems. Different from other types, MPS II is the only one that is inherited in an X-linked pattern. Therefore, there are more male patients than female patients. Each cell in the human body contains 23 pairs of chromosomes. One chromosome from each pair is from mom, while the other is from dad. One of the 23 pairs will decide the sex of the baby. They are called the sex chromosomes and are different between males and females. The other 22 pairs are called autosomes. The defective gene is located on one of the 2 sex chromosomes, the X chromosome. Since genes on the Y chromosome do not pair up exactly with the X chromosome, males with 1 copy of the defective gene on their X chromosome will express the disease. Females with 1 copy of the defective gene on their X chromosome will not express the disease, but rather become carriers. When a carrier mother and a normal father get pregnant, if the baby is male, there's a 50% chance he will be normal, and a 50% chance he will be a patient. If the baby is female, there's a 50% chance you will be normal, and a 50% chance you will be a carrier. Therefore, genetic consultation plays a very important role. The symptoms of MPS II generally becomes more prominent between age 2 to 5. These typically include large protruding foreheads, excessive thick hair, stuffy nose caused by a low nasal bridges, breathing problems from full lips and large tongues, protruding stomachs due to enlarged livers and spleens. Umbilical and inguinal hernias are also very common. Average height falls between 120 to 140 centimeters tall. Although there are medical resources available to alleviate the symptoms, there is currently no cure for MPS. Treatments like enzyme replacement therapy, administered weekly through IV infusion, can help slow the progress of the disease. Still, we must always remember, care today is hope tomorrow.